Hi, everyone, and welcome to the U.S. Japan Council's webinar, The Coronavirus in the U.S. and Japan, Perspectives from the Health Sector. I might just give it a couple more minutes. Let people get on. Hi, everyone, and welcome to today's webinar. Thank you for taking the time out of your busy day to participate. My name is Laura Winthrop Abbott, and I am the Executive Vice President of the U.S. Japan Council. We recognize the incredible toll the coronavirus is taking on the lives of so many, and we offer our profound gratitude to the first responders and everyone on the front lines. The U.S. Japan Council is an international nonprofit whose mission is to develop and connect leaders to create a stronger U.S.-Japan relationship. Founded by Japanese Americans, we focus on bringing together leaders of the United States and Japan from across backgrounds, sectors, and generations to partner for a better future for the Asia-Pacific region and the broader world. So I'm really grateful that today we have experts from both Japan and the United States from the health sector to offer their perspectives on the coronavirus. I thank Dr. Mary Collins, Provost of the Okinawa Institute of Science and Technology, for being with us today. And I thank Dr. Hiroyuki Fujita, member of the U.S. Japan Council's Board of Councilors, founder and CEO of Quality Electrodynamics, and chairman of the board of the Cleveland Clinic at Hillcrest Hospital, for also being with us. Thank you. This webinar is the first in a series of webinars related to the impacts of the coronavirus in the US and Japan that the US Japan Council will be offering as part of our broader shift to virtual programming. So just a couple of reminders for this session as we kick off. This call is on the record and is being recorded. As a participant, you are automatically on mute and your camera is off, so you don't have to worry about everyone seeing you. If you would like to ask a question, please do so as soon as you think of the question by typing it into the Q&A section on the Zoom screen. Your questions can only be seen by the panelists, not by all the participants. The moderator will be curating these questions and will ask them when we get to the Q&A section. The moderator will get to as many questions as possible, but we may not be able to get to all of them. So today we are pleased to have David Janes with us here to moderate our discussion on the coronavirus in the US and Japan, perspectives from the health sector. David Janes is a council leader and a member of the US Japan Council's Program Development Committee. He's also Senior Advisor for Institutional Development in the Office of the President at the Okinawa Institute of Science and Technology. We are tremendously grateful to David for moderating today's discussion. So David, with no further ado, I turn it over to you. Thank you.
Thank you, and it is a real pleasure to be moderating this webinar today, and I particularly would like to thank Laura Abbott and the entire U.S. Japan Council team for putting this very timely and important event together. And I want to thank all of you who are joining us today, all of the participants, and I hope that you and your families are doing well during this challenging time. Before we get into the heart of this event, we have a poll that we're going to send out to everyone, and this is going to ask you a few questions about what you think about the lessons that the US and Japan can learn from each other in response to this pandemic, and what is the sense of timing in regard to when the situation will begin to improve globally. So I've launched that and I'm receiving some responses, and we'll give it about 30 seconds and then I'll share those back to you. By the way, we have 236 people signed on to this call, it appears, right at this very moment. So an incredible turnout. So far, 106 people have voted on this. I'm going to give it about 5 more seconds. Not everyone will probably get to have their vote in. I'm going to end the poll, and I'm going to share the results with you so that you can see what other colleagues think. 98% of you do think that the US and Japan can learn lessons from each other's response to the pandemic. And it appears that a majority, 61%, believe that the situation will improve in 3 to 6 months, and 24% think it'll take a year. 5% think it will take more than 1 year. So I hope that is just interesting to get a pulse on where everyone is. So now it's my pleasure to introduce our two distinguished panelists who have taken the time to join us this evening in the US and this morning in Japan. First is Dr. Mary Collins, who, as Laura mentioned, is Provost of the Okinawa Institute of Science and Technology Graduate University in Okinawa. She is formerly the director of Britain's Medical Research Council Center for Medical Molecular Virology and former Dean of the Faculty of Life Sciences at University College London. Thank you very much, Mary, for joining us. And also Dr. Hiroyuki Fujita, we're very pleased to have you with us. He is a member of the U.S. Japan Council Board of Councilors, founder, president, and CEO of Quality Electrodynamics, and chairman of the board of Cleveland Clinic Hillcrest Hospital. He also is CTO of Canon Medical Systems Corporation in Tochigi, Japan, honorary counsel general in Cleveland, and a trustee of the Ohio State University. We're very pleased to have you with us as well, Hiroyuki. So thank you both for joining us. The overall goal of this discussion today is to gain a U.S.-Japan perspective on the coronavirus situation and to discern some concrete action steps that the U.S. Japan Council and its members can take to address the situation now and in the future. So let's begin. I would like to ask both panelists to tell us a bit about the situation right now, where they are. And I'd like to begin with Dr. Collins. Dr. Collins, you're in Okinawa right now, where there have been relatively few cases of coronavirus. And Dr. Fujita, you're in Ohio, where the state is under lockdown. But Mary, could you tell us a bit about the current conditions in Okinawa?
Sure. We feel very fortunate. We're an island quite away off the main islands of Japan. And at the moment, Okinawa life carries on pretty much as usual. We are practicing social distancing. We have we have no visitors basically from overseas, and we're just bringing in quarantine for visitors from the mainland at our university. But we are still working, and we actually have meetings with more than one person in a room. We are functioning. We're a basic research university, and we're trying to help a little bit with some projects that help the corona effort. But at the moment, life is not so different.
Thank you very much for that. And Fujita-san, what's the situation like where you're at in Ohio?
Sure. So first and foremost, I hope all is well with everybody, and staying safe and healthy. This is a unprecedented crisis, which is attacking all of us in the whole world. So as David said, I want to talk about what's happening in Ohio. So as of today, and the number is changing every minute, as you may guess, but the number of cases in Ohio, it's almost 2,902 cases in Ohio. And number of deaths in Ohio as of today is 81. Now, the area that we are operating, part of Cleveland, it's called Cuyahoga County. And then in this county, we have 589 cases and then 9 deaths. Now, what happened was that, so we had a first COVID-19 cases in Ohio on March 9th, just 3 cases in Cuyahoga County. Those were the first 3 cases that took place here in Ohio. Now, Governor Mike DeWine, in Ohio, he issued an executive order, stay at home, on March 23rd. And since that time, basically all the restaurants, public places, and schools, universities are shut down. And we also are mandated to apply social distancing, which is either 6 feet or 1.8 meter to maintain between the two people. And we are also encouraging people to wash hands as frequently as they could. So I mean, within this past few weeks, the way we live in Ohio, or for that matter, I mean everybody in the whole world, it has changed the way we live, the way we do business, the way we communicate forever. So, but I must say that comparing a state of Ohio to, for example, Michigan, a neighborhood state, our cases, the number is much smaller than what we have for Michigan. And I think that this is because of the, I must say, courageous decision that Governor Dwayne has made, before this became a big issue. So it was a very challenging, order to everybody, as you can imagine, because we have to shut down the business. But I think this social distancing, staying at home, I mean, I think they are helping the situation. So that's a brief update from the state of Ohio.
Thank you very much for that. I'd like to remind all of the webinar participants that if you have questions, you should write those in the Q&A section, and we'll weave those in throughout the conversation and also dedicate a portion of time at the end for those. One of the questions that actually has just come in, which I'd like to address to Mary, is what is the current situation in Japanese hospitals? This questioner says that public data seems scarce. So Mary, you've commented already on what the situation's like in Okinawa, but to the extent that you're aware, I wonder if you could give us a quick sense of what's going on in other parts of Japan, especially related to the hospital situation.
Well, we obviously have contacts and research colleagues in Tokyo. And at present, there are obviously cases and some deaths in the Tokyo hospitals, but the Tokyo hospitals seem to be managing at the moment. I mean, this leads on to the bigger question of whether the situation in these big metropolitan centers in Japan is about to get worse. And I have no real clear answer to that. It's my personal opinion that the number of cases in Tokyo, Osaka, Kobe could actually increase now. But I think we're at a stage of waiting to see if that explosion in cases comes.
Thank you very much for letting us know about that. Just to continue on some of what is going on in Japan, I think many people also are wondering what the status is of a search for therapeutics and a cure. And coming out of Japan seem to be several possibilities. Avigan was mentioned. There are other therapeutics coming out. And Mary, I wonder if you have any particular thoughts about those.
I mean, my experience is basic virology. So Avigan is a virus enzyme inhibitor that was developed for flu, which has the same kind of enzyme as coronavirus. But the two proteins are very different, okay? So Avigan did show some effect on patients in China, but I would strongly urge people to wait until there's a clinical trial data on this, where you need to treat some patients with the drug, some with a placebo. You need to have a sort of what we would call a blind trial so that people don't know which drug they're receiving before we're sure that this works. What you don't want to do is roll out a drug that has more hope than real data. So there is hope for Avigan, but I think we need to have a clear test of its efficacy in a clinic.
And could you give us just a quick sense of your thoughts about a vaccine, the time it might take to develop a vaccine for something?
I think the minimum to show that something's working in small clinical trials could be, I think, by the end of this year. We have to be aware that if this becomes a seasonal virus, we need to test the vaccine before this global pandemic stops, okay? So if we look at those timings that people are thinking, if the situation is really improving in 6 months, will we have a vaccine ready to test by then? That's a question. And then the next question is, when it comes back, if the virus does come back on a broader base, will we have the capacity to manufacture a vaccine that's shown efficacy in a small trial? So I think it could be that we have a vaccine by the end of next year if we have a big concerted effort. It's not technically impossible to make a vaccine to this type of virus, but I think that there are several constraints between around testing it and around rollout of a large-scale vaccine.
Thank you. I'd like to, Fujita-san, get your take on several aspects of this. Dr. Collins told us a little bit about the situation in hospitals in Japan. You, of course, are chair of Cleveland Clinic. I wonder if you could tell us a bit about what the situation is like there. And to the extent that you feel comfortable, I wonder if you might also comment on what your colleagues there are thinking in regard to therapeutics and a vaccine.
Thank you. So, let me start by saying that, as you may know, Cleveland Clinic is one of the biggest hospital systems in the whole world. We have 60,000 caregivers within the system, and I can tell you that they are all, around the clock, trying to help all the patients. Now, lately, what we have been able to do is to have an in-house testing capability of this coronavirus. And we today have 1,300 tests a day, and it takes 8 hours to find out the outcome. So we are trying to do, what we can in the quickest way to address this issue. Now, I think this pandemic and the coronavirus have changed the way the hospitals operate. What I mean by that is now we do not first accept the patients, right? I mean, they have to go through the virtual online, visit, and then they have to go through the questionnaire and the exams, and then they have to talk to their primary physicians to get their advice if they are, if they are found to be, suspicious, right? So today, what we are concerned about is having, coronavirus patients without knowing they have those diseases, and then they transmit those diseases to other, patients within the system. So some of the things we are doing is, for example, pediatric department. We are moving that pediatric department to one particular campus, so that we don't try to mix, let's say, two different kinds of diseases. And also the cardiology, same thing. So basically, I mean, as we talked about already, even the way we manage the hospital, social distancing is a key. I mean, you do not want to create an environment where people, come into contact. So that's something we are doing. And then, when you talk about this vaccine and other things that we talked about, at the Cleveland Clinic, we have what we call Cleveland Clinic Pathology and Laboratory Medicine Institute, investigating COVID-19 disease now. We have 1,400 dedicated caregivers for that institute. They are testing more than 20 million tests annually. So we are hoping to find a cure by accelerating, what we can do, and then, leveraging all the resources we can access, because we do have a, hospital network, not only in the States, but also in Canada, UK, as you may know, London, Abu Dhabi, Toronto. I mean, so we are, collaborating with all the caregivers to, learn from each other as to how they treated their patients at their site, so that we try to, once again, learn lessons from each case and try to be, make it a knowledge for other people to be able to access. So that's what's happening at the Cleveland Clinic.
Thank you for that. You've mentioned social distancing, and we're receiving a few questions, not only about that, but also in particular about masks. And, one particular question would like to hear you speak about masks and how we should think about them in our daily lives during activities outside of our home while we shelter in place. You know, if you're in your home and you're going out to get groceries, there's been a lot of mixed messages, I think, in the US on this. So I wonder if you could comment on wearing masks for the general public.
So I think wearing a mask is a very important thing for us to do to prevent us from getting this disease. And I think to that end, you know, people in Japan, I must say, they have been doing better because they have, you know, this high standard for hygiene, right? But I think people in the United States are also learning the importance of that. Now, initially, when you talk about the mask, the quantity of those, right? I mean, in the States, we did not have as many as we wanted. So the way we talked about is that if you are sick, if you are ill, you know, cover yourself and wear a mask, right? But if we can get more masks, actually everybody has to wear that. In fact, at our company, I mean, I'm not wearing a mask now, but I just took it off. But when we go to a meeting at our company or do other things or where we become closer to other people, we do wear masks because that's, you know, that's a very basic thing, but it is very effective to block the this disease, right? So that combined with, as I said, social distancing, washing hands, they all become very important when you combine everything together because that's a preventive measures we have to take. Everybody has to take that. It's not just one person. So at our company, I mean, you know, I don't want to go tangent to the question, but although the governor has given the executive order to shut down the businesses in Ohio, since our business is a medical device business, we are considered as a exception. So we can operate and then we can do our, you know, business. However, with all these, you know, protective measures, as I mentioned, you know, social distancing, you know, wearing masks, washing hands, and you know, sanitizing the workplace, you know, a few times a day. I mean, those are the things we have to do to operate our business. So it's very challenging.
It's very interesting. Mary, I wonder if I could get some of your comments on masks. Sure. Not only a general sort of comment on whether or not you think general public should be wearing them, but also the quality of the mask. Does that matter? Some people have asked here, you know, cloth mask versus an N95. And I, you know, I wonder if you can even get masks. Or last time I was in Okinawa, it was very tough to even find one. But
sure. Well, obviously an N95 has got a chance of reducing actual virus, but I think surgical masks and cloth masks reduce the droplets of water from a sneeze or a cough that contain virus. So that kind of mask is better than no mask, I think. Current WHO advice is wear a mask if you have any symptoms of a cough or cold, or if you're looking after a coronavirus patient at home, say. I think they're about to amend that guideline to recommend more mask wearing. Certainly also food servers, we've asked them to wear masks on campus at this point.
I'm changing gears slightly. There's a very interesting question that has come in, which I'll turn to you first, Mary, and then Hiroyuki, turn it to you second. The question is, what does an all clear look like? No country has yet been able to fully get back to normal. So there is no roadmap for this. So what would it look like for us to, what would the path be for us to get to some degree of going back to normal? Mary, you're on mute.
I think, as Fujita Sensei's already mentioned, the key to a lot of this is testing. So we need to understand the real number of infections. Now, the PCR test for actual point of infection, that is difficult to apply without a clinical assessment, because if I walk up to someone in the street, they may be asymptomatic but still have the virus, and they may test negative. So what I really think is that coming out of this, we need to have antibody tests to see who has been infected in the whole population. That will give us an idea of virus spread, of how many people have been infected. Then we need to monitor very carefully new cases and trace all their contacts. And only with that will we get down to the sort of situation we were in before, where it was a rare occurrence and we knew about every new case. That's what I think it'll look like at the end.
Fujita-san,
Yes.
any comments on that?
Yes. So first of all, I think it is location dependent, right? And if I talk about the Ohio, Cleveland area, at Cleveland Clinic, we are expecting apex, the peak, to take place around mid-May. So we are estimating another 1.5 months to go. And then after that, I mean, what's important is that we are going to, flatten it, right? Plateau it, right? And then once we do that, we have a reasonable confidence that we are, managing this disease. And then after some time, I think it will become like another flu, where there will be always some patients with COVID-19. But what we are trying to stop is this pandemic, right? Every day you are getting more patients, I mean, everywhere. And the rate of that increase is just so dramatic. And that's what we are trying to stop. So, combined with, like Mary said, I mean, testing is very important so that we know more about this disease. And then once we understand how to, let's say, manage this disease, then we can say we are reasonably out of, let's say, this disease. But there will be always patients with COVID-19.
There are several questions that are coming in, and I'd like to begin with you, Fujita-san,
Yes.
In regard to the impact that this disease is having on how we run business. And a particular question that is actually addressed to you, it asks what steps you are taking at your company, the company you founded, Quality Electrodynamics, to ensure safety, but also how is this impacting your company in terms of the possibility of having to lay off staff or change your operations to remote operations? I wonder if you could comment on that for some of our webinar participants.
Yes. I mean, it's actually excellent question. And to be honest with you, I mean, we've been struggling with that question every single day. Now, having said that, I mean, we all agree that no matter what we do, safety and health are the most important things, right? Priorities to everybody. And then at my company, QED, I mean, here we have it's a medical device developing, also manufacturing company, right? So we have engineers, scientists, business people, and also we have manufacturing people, assemblers, and who support the manufacturing activity. And the challenge is that some are exempt and some are non-exempt. And in the United States, depending upon what category you fit into, I mean, there are different implications per human resources, guidelines, which we have to abide by, right? So hourly people, salary people, there will be a different way of handling this situation. But as of today, at our business at QED, we have not laid off anybody because that's something I have been believing in since the inception of the company. I mean, to me, everybody is a family member. So just because this hardship, takes place, it does not become a reason for me to make a decision to lay off people because they need these jobs to make living. And when you think about it, I mean, most people have, have mortgages to pay, right? If they miss a paycheck or two paychecks, I mean, suddenly their living condition may be very challenging. So we are quite aware of that. That's the reason we are trying to support whatever we can, so that people can, our associates can make living. So while doing that, we still have to implement social distancing, sanitization at work a few times a day. And, so we have to apply 2 shifts for engineering and research and development, for example. And, changing time schedules for manufacturing, associates, depending upon what products they are making. So, I mean, I would say, and then, most important thing is that we must communicate very clearly to our associates what we are doing in a very visible way, because they want to know what the management is doing. We cannot just sit in a conference room and talk about what we want to do, how we want to do. Once we decide, I think it's extremely important for the management and for me to share that with all the associates as to what we are doing, what's happening, how they are being helped, so that way we can have a unity as a business. So, but easy to say. I mean, that's a continuous effort that I've been doing every day for the last 15 years. So it doesn't stop here. I'm going to keep doing that.
Thank you very much. And Mary, you are working hard at the Okinawa Institute of Science and Technology to ensure that things remain as safe as they can on campus. And wonder if you could talk a little bit about mitigation strategies and
of course.
situations.
I mean, I think that we are asking everyone to home quarantine if they have any symptoms and to contact our physician. And then we have a home quarantine for 2 weeks on return from other parts of Japan. There's no international travel now in Okinawa. And on campus, we're trying to reduce the number of people on campus by home working. We have some projects to try to help the local situation. For example, our students are making hand gel, as we hear that some care homes in Okinawa are running out. So we have a chemistry student-led project to make hand gel. And we are ramping up to produce, we hope, some diagnostic tests here also. One of our colleagues is trying to demonstrate that reusable masks, that sterilization of masks is effective and generates masks that can be reused. That would be very helpful for local hospitals and care workers, as well as on campus.
Thank you. There are a number of very interesting questions coming in with a kind of theme to them about what way can the US and Japan learn from each other, about different strategies they took, what are ways that the US and Japan can work together in the future. I am going to we're going to keep talking, but I'm going to launch our second and final poll, which asks everyone, and you'll see this coming across your screen now, I hope. In what areas do you think the US and Japan relationship can be mobilized to mitigate future pandemics? So while you're answering that, I would like to, Mary, get your thoughts on a question that has come in that relates to this to some extent. The question is, it seems that Japan and the US took very different strategies to public health practices to try to contain COVID-19. How can we better coordinate across border activity? Information sharing has become a flashpoint. There seems to be some growing mistrust between countries. So how do we reestablish communication around public health strategies between the US and Japan? What can both countries perhaps learn from each other?
Well, I think we need really clear analysis of the data when we have time, which I agree very much with Fujita Sensei that this will be an annual thing, that we will have waves of this infection, and we need to understand very clearly what happened this time in terms of what measures were effective truly, as opposed to by rumor. And also cases and deaths need to be really verified in each country in the same way. So I see a period of data collection, data comparison, and data analysis later this year. I think we need to really understand which measures that are rumored to be successful really were successful. I think Japan has taken a very different attitude, and I think it'll be interesting to see if that pans out or not. Now, none of this helps in the current pandemic situation, crisis. And there I would say, again, we do need more communication between medical directors of hospitals, between national testing, national public health bodies, just to see if we can learn lessons as the situation is continuing this time.
And Fujita-san, what are your thoughts on ways in which the US and Japan could effectively work together, especially around public health practices? And also, do you think they've both taken a sort of divergent path so far in the current strategies to mitigate the situation?
I think that I'm going to talk about the United States first. I'm talking about the healthcare industry in particular. Now, to us, I'm going to include myself here as well. I think to us, it was a wake-up call, because now, people in America know how much we depend upon other countries to get essential things, like medical supplies. You talk about masks, you talk about the gloves, or whatever. I mean, most of the things come from China in this case, right? Now, and then you talk about ventilators. We need more ventilators. We need more respirators, right? All these things that can save people's lives, we cannot get it immediately. So after this crisis is over, I think that there will be a huge movement to insource all these activities in the United States. For example, you're already seeing Tesla making ventilators, right? And GM also ventilators. So I think that now people and leaders to that end, political leaders to that end, they do understand how critical it is for the United States to have those resources in-house. So having said that, I think, this kind of pandemic is not just a problem to one country, right? Right now, it is touching every country on this planet. So to that end, I think, what's going to be important is that, for example, USJC can become a platform where, US policymakers and Japanese policymakers convene to talk about what we can do together to expedite our treatment, namely, having medicine much quicker, having medical equipment much faster, right? Because today, Japan is governed by MHLW and the United States FDA. They do have different processes and different approvals. So for this kind of a pandemic, I think it's very important to streamline the processes and also approvals so that all the people, whether you are, American or Japanese or, other, nationals, can benefit from the ingenuity of mankind. I think so. In the coming years, one of the opportunities we have as a USJC to make a maybe study group or working group to be a matchmaker between private sectors in both countries, for example, right? I think we have a lot of opportunities, but what I'm saying is that now, we have to help each other, and then what's happening in the United States will happen in Japan, vice versa. In that case, it may not be an effective way to have its own process and approval, approval processes, because we may lose all the opportunities in between. So I hope I'm answering your question, but that's what I think.
Thank you. And I think, part of what we want to accomplish in this webinar is to get people who are involved in the U.S.-Japan relationship and members of the U.S. Japan Council to think about some concrete ways to be engaged in the future. So I thank you for that, and we certainly look forward to ideas from everyone who is here. I'm going to do a bit of a rapid fire through a number of the questions that are touching upon themes that perhaps are a little different than we've covered, or maybe very specific. The first one is to Dr. Collins. And the question is, there is much discussion in Tokyo of whether to declare an emergency so social distancing can be enforced. What do you think of that? And also, with restaurants and bars still open in Okinawa, does this worry you?
Yes. So I think it's an interesting, as a foreigner living in Japan, I'm be interested to see how much voluntary social distancing versus compulsory social distancing, how much difference it would make. I'd like to think that people are now voluntarily doing what they're asked. But I personally would be on the side of more caution in Tokyo than has been shown so far. In Okinawa, yes, it does worry us. And so we're trying to practice distancing off campus and advising people not to go to crowded places, etc. And we have the governor of Okinawa has asked people not to leave Okinawa, basically. And we've also have this quarantine for people coming from mainland to Okinawa if they're coming to OIST. So I think we regard Okinawa at present as a bit of a bubble.
And I hope everyone did see, I think I left the poll results up there for quite a while, but I hope everyone did see that the top two areas that everyone suggested the U.S. and Japan can work on are biological research and public health research. So just wanted to mention that to everyone. Thank you, Mary, for sharing those views with us about Tokyo and Okinawa. I'd like to address this next question to Fujita-san. Although it's a large question, but I think you would have some interesting insights. The question is, in the United States, we're experiencing significant challenges receiving consistent fact-based messaging. The result has been an undermining of confidence and confusion, this questioner states. So what are the public health lessons we can learn from both the US and Japan experience, and also what are your thoughts on the messaging that's being sent out, particularly from your lens being at Cleveland Clinic?
So you are talking about the data accuracy in America. Is that what you are talking about? Or are you talking about some data which came from, let's say, other places, other country, and then that could have impact, on what we should have been doing, in January, February. I mean, so I'm just trying to clarify the question. So you're talking about United States.
I think the questioner is concerned about different messages that are being received. I'm going to put a bit of words in their mouth, but perhaps the federal government providing certain advice that might be inconsistent with state governments. Mixed messaging coming out right now, as we've discussed earlier, about masks, CDC indicating shouldn't wear them in public, and other individuals and organizations are suggesting perhaps we should. What advice would you have, especially, I think this is an interesting question for you as a CEO of a company too, chair of several boards. When you think about messaging in this situation, how would you perhaps think about doing it in the future to make the situation a bit better?
Sure. I think this is, this can be a bit sensitive question because we need to talk about the leadership. And I think what we have all learned this time is that, as a leader, you have to be very proactive and you have to put resources, at a very early stage to gather the data, because you see, all the decisions we have to make, whether we are in business or in healthcare or whatever, in government, wherever, right? I mean, if the data is not accurate, our outcome, our decision will be wrong. So I think that's something the nation has, understanding the importance of it. So going forward, I'm sure there will be more resources allocated to gather the data and make a consistent policy. And what I mean by consistent policy is that it's not just the government. We have major universities, major hospitals, research institutions in this country. So they have to come together more often to to understand where we are collectively together on an issue like this. And then we have to keep sending the message out. I will tell you one example, which was unfortunate. And then, recently President Trump referred coronavirus as Chinese virus, right? And that one phrase, the impact of that to Asian community in the States is quite negative. Now, if the president is saying that, people who who are ignorant, may immediately, associate the disease with Asian people, right? I think this kind of thing can be controlled by having objective, accurate discussions from the top, very top. So I think we are all learning the lessons. And, talking about my own business, I always share this with my management. We have to keep sending the consistent message in a visible way. We want to make sure that people understand and see how we are communicating. So these are, some weeks now, I have been spending most of my time on communication, whether it's Cleveland Clinic or, a company or Ohio State University board. So I think that people, understand once again how important it is to have quality, consistent communication in a very timely manner. And I don't have to tell you this because you all know this, in what you do. So
that was very helpful. Thank you. And just there was one follow-up question that has come in that relates to this, specifically addressed to you, Dr. Fujita,
yes.
Which is, where do you, if you're willing to share personally, or where do you advise members of your corporation or organizations you advise to look for data about the current situation? Do you look at the CDC, or
Yes.
are there other places that you sort of turn to?
CDC and in Ohio, actually, thanks to the leadership, Governor Dwayne has made it very clear, because he is communicating daily to all the citizens in Ohio. And the information, he makes sure that everybody knows where we can get most up-to-date, data and information. So at least people know. And then, he's been coordinating with, of course, federal government as well, and NIH and CDC. So the information is accurate. And then on top of it, Cleveland Clinic also is being a major healthcare institution. They have their information also shared with federal and state governments, and then beyond. So today, what we are trying to do in the United States is to have a common, most up-to-date data that you can trust, right? Without it, people cannot make a judgment. So I think this consistency is very important, and then that will be achieved when people get together, convene together, and then talk about how they want to manage. It's no different from the business. We have to decide how we communicate and then where to look.
Thank you. I'd like to, we're rapidly running out of time and have so many questions, and we're trying to get to as many as possible, but let me turn it over to Dr. Collins for a moment and ask you two questions that are perhaps somewhat combined. The first question that several people have asked is, what particularly can the U.S. Japan Council do, and people listening to this call, to help Japan? I think this comes out of a spirit, the U.S. Japan Council played a incredible role, and Laura Abbott and many others were deeply involved in the aftermath of the Fukushima disaster and the 3/11 tsunami and earthquake situation. Obviously, we're facing our own crisis here in the United States, but Mary, what would you say are specific things that perhaps people in the United States or who care about Japan could do? And then the second question is, could you just talk a little bit about the state of U.S.-Japan scientific, or research collaboration from a university perspective, especially when U.S. universities, many of them are shut down?
So I think sharing of public health data and advice as we go through this would be very good. If the U.S. Japan Council could bring together healthcare professionals and governmental advisors, that would be amazing. That's very hard to get out of people's busy schedules at the moment, but some of these people are not involved in hospitals. They're basic researchers and they're probably working from home. So that's a possibility to broker some discussion as to how the situation is evolving both in US cities and in Japanese cities. I think that would be incredibly useful. And there's a sort of maybe a top tips page about reuse of masks, about ventilators, about testing. All of those things are also helpful, I think. So that would be very much directed at the medical and the research end. Clearly, which is not totally within my expertise, but there must be some sort of Japanese US business collaboration that can be done to spread some of the innovations that are really coming quite heavily out of the US and some of the medicines coming out of Japan, and see if we could get those tested in both countries and operational in both countries. A point made by Fujita sensei about trying to change the medical regulatory framework so that things are compatible between the two countries would be another big move, I think. Sorry, what was the other question?
About research collaborations.
Oh, yes. Research tends to be rather personal. So some things have to actually move between countries in research. That's a problem. That's not the coronavirus, it's okay. But I think that people are getting very used to the webinar. People have time to speak and think now as the laboratories are getting closed down. OIST is still running, so we've been doing some experiments for collaborators on our campus. So I think communication needs to be maintained through the web, and we're working hard on that.
And I'm going to just ask one final question from the questioners and then give each of you a moment to make a final remark here. But I'll just address this, I think, to you, Mary. A question has come in about a central group of experts in Japan to recommend effective measures. So I guess the questioner is really asking, does Japan have a kind of coronavirus task force that you're aware of? Who's on it? Any particular comments on that?
I don't know the details. I don't believe so. We don't see a panel coming out on NHK, for example. So I don't know. I don't know that that's public information. Yeah.
Fujita-san, any comments on that?
I am not familiar with the task force in Japan either, but I think now may be the time for Japan to make a NIH equivalent institute.
Exactly.
So that NIH Japan and NIH in the States can collaborate on this kind of a pandemic and then, unknown diseases to coordinate the efforts on both sides. So I think, it's a great opportunity for Japan to seriously, look into this crisis and then form a, Japan's NIH.
Very good idea.
And on that note of providing, I think, a very practical kind of idea as we reach the conclusion of the webinar here, I'd like to give each of you a chance to perhaps make a final concluding comment that has been going through your mind that you haven't shared, or in particular, I'd be very interested if you have one final kind of practical suggestion that you would like listeners on this webinar to think about or take action on. So Mary, I'll turn that to you first for a final remark of a minute or less.
As a basic researcher, I think timely comparison of public health data cases, testing protocols, treatments, outcomes would be extremely valuable as we go through this now, and as we both think this will come back as some kind of sporadic disease. So if that could be brokered between Japan and the US, that would be extremely valuable, I think, especially as the course of disease in the two countries looks different.
Thank you very much. Dr. Fujita, final remarks and any practical.
Yes, so what I have been asking my associates here, and actually my family members to that end as well, is that, you know, we have to behave as if we were a COVID-19 patient. So, you know, many people, they don't even know how they got it, right? And then we are fighting against this unknown disease. So it will come back to, it will, you know, become just a common sense. But I think we all have to behave as if we were the COVID-19 patient. Then what do I do to prevent you from getting a disease from me? Right? I think, you know, wearing mask, wash hands, and then social distancing, you name it. I think that common sense will go for a long distance. That's what I think. And thank you very much for having me today.
Well, I'd like to thank both of you, Dr. Collins and Dr. Fujita, for taking time out of your busy lives, doing very important things related to this situation. We really thank both of you for your time, energy, and really thoughtful and deep insights here. And I want to also take a moment to thank all of the webinar participants. There are not only a rich number of questions that we asked, but a significant number of questions that did not get asked yet or answered yet, and some very interesting discussions going on chat. And I know the U.S. Japan Council will work to go through those and figure out ways to get answers and put some of these ideas into action. Before turning it over to Laura for final remarks, I just want to thank again the U.S. Japan Council for putting this very important and timely event together. And I want to wish everyone good health. Laura, thank you so much for having me, and I'll turn it over to you for final remarks.
Sure. Thank you so much, David. You did an amazing job getting to a tremendous number of questions. And Dr. Collins and Dr. Fujita, thank you so much. Your comments were fascinating, and we truly appreciate your sharing your expertise with us. I want to thank also all the participants for giving up your time to be with us today. And I'd like to encourage you to sign up for our next webinar, which is going to take place at 6:30 p.m. on Monday, April 27th, Eastern Standard Time. That's 7:30 in the morning on the 28th for those in Japan. And we'll be focusing on the societal and economic shifts taking place in the US and Japan as a result of the coronavirus. And the next webinar will feature Kathy Matsui, who's chair of our Board of Councilors at the U.S. Japan Council in Japan, and she's also vice chair of Goldman Sachs Japan. And it will also feature Dan Okimoto, member of our USJC Board of Councilors and Professor Emeritus of Political Science at Stanford. And he's also the co-chair of the Silicon Valley Japan platform. So we'll be sending everyone who participated today a follow-up email requesting your feedback on this webinar, and also including registration information for our next webinar. So thank you everyone for participating today, and please stay safe and healthy. Thanks everyone.